Merhaba, hoş geldiniz. Çocuklarda antipsikotik kullanım.
The usage of antipsychotics in children and their long-term efficacy. Well, actually, my colleagues have mentioned about it all, but briefly I would like to talk about the last 15 years. 2 to 4 times more antipsychotic atypic usage is increased amongst children, and in terms of indication, most frequently the concentration lack and also the bad behavioral disorders, mental retardation, autism diagnosis we see amongst children who use this medication. The data is not sufficient, but recently in the small kids it is increasing. One of the most important factors here that we have to think is that there are long sample follow-up, which is not a big sample follow-up is not enough, and the compliance to the guidelines is also not enough. And with long-term adverse effects, we know that there is putting on weight, diabetes, hyperprolectemia, and neutropenia, aggressiveness, we see them. And in terms of weight gain, I'm going to be talking about the adverse effects briefly because the previous speakers have talked about acute adverse effects. The PIN, we see the most weight gain is encountered there. Epiprazole also is the most safe between 25 to 30 patients when we administer them. With one patient, we see an adverse effect. With a 1 year follow-up study over is 40% Kirkepin, it is 50% weight gain, and as the duration of the therapy increases, the weight gain also increases. This is a follow-up study which has been carried out recently. Triglyceride also is correlated with weight gain, and also hypercholesteremia is 40.9%, and LDL triglyceride increases all of the same rates. In the first 6 months, it is significant. In the month 12, it increases more. Diabetes risk. Antipsychotic, antipsychotic usage, it is really high, and 13 studies have been evaluated. The median age is 14.1, 7.1 years of follow-up. A meta-analysis study was carried out. Type 2 diabetes metals incidence risk with antipsychotic usage compared to healthy control, it is 3-fold, and psychiatric control, it is increased by 1.8 times. Which is this meta-analysis has been issued last year. All atypical antipsychotics, red marks warning diabetes mellitus development is the case. With diabetic children, there are cases that they have been safely treated, and the diabetic development can be irrelevant from weight gain, according to the study. Cardiovascular scale, again with children, long-term follow-up studies, and data is not sufficient. QDHA distance increases, orthostatic tension, and also tachycardia are the incidences. And zipritizone, actually, it focuses on studies about, there are also facts that other antipsychotics are safe. No sudden death has been reported, but guidelines say that caution has to be bared. A recent study in 2015, Journal of Attention Disorders, between 6 to 16 years of age, 37,000 children followed up for 1.5 years, and cardiovascular risk is not detected. So cardiovascularly, it is safe. At the atypic ones, aggressive and neutropenia, we can see that, especially with clozapine, neutropenia and fatal aggressive risk is emerged, and this is higher in children. Risperidone and kelotropin analysis and neutropenia cases have been reported, and also it should be followed up. And in terms of liver function disorders, there are cases which have been reported, fast weight gain, and also liver fattening is the case in adults, and liver function tests have to be carried out as a recommendation. Hyperlectemia, when we look at that, the highest risk is risperidone and paliperidone come into scene, and aripiprazole is the safest. 9 nanogram milliliter and below is encountered as clinical, and in time it drops down to normal level, and it follows as asymptomatic. And baseline is not recommended. Baseline check symptomatic prolactin. It should be checked and followed up. Symptomatic prolactin, if it continues with long risk, antipsychotics should be switched to, and measurement should be carried out, and dopamine in combination is also a recommendation. Between 5 to 15 years of age, 700 cases included in the study, 5 studies. In the first 2 months of the study, prolactin faster increases. After 5 months, it drops down to normal level gradually. Again, antipsychotics therapy treated patients, 67.5% of them in the first 6 months, prolactin increases. After 1 year, 45.5% hyperprolactin continues. Hyperprolactinemia doesn't have an impact on growth and puberty on a retrospective study, but hyperlactopenia, long-term effects, we don't have information. Clozapine actually leads to syndrome, and extrapyramidal, I'm not going to go into adverse effects. The lowest risk, again, quetiapine and clozapine, and operazine and ciprazone and risperidone, they have high risk. Neuropathic Marie syndrome, with all atypics actually, cases have been reported, however, very seldomly it is seen, and the risk is the same in all age groups. Quetiapine, animal studies have been carried out, cataract has emerged, risperidone, clozapine, cataract cases have been reported. Initially and post 6 months lens examination is recommended, and no cataract cases have been reported amongst children. Comorbid side effects, there is not sufficient data. Animal studies and laboratories reveal that antipsychotics do have adverse effects on the developing brain. I will look at the current guidelines. What do they say about antipsychotics children? The recommendations. The children who are in the growth period, antipsychotics tolerability and long-term adverse effects, in order for them to be clearer, more studies are needed. So still, in terms of the safety and efficacy, we don't have enough data. With small children, there are 3 guidelines. Antipsychotics, the usage in small children, the efficacy and the confidence, the data is not sufficient in this respect. Psychopsychological intervention is recommended, and it should be used cautiously, this medication. And American Adolescent Psychiatry deems children under the age 6 small children, and Texas guideline deems children under the age 4 as small children, infants. When we look at antipsychotic usage of 2 and more, very seldomly actually, it is not actually recommended because there is not enough data. If needed very much, it should be followed up cautiously. Antipsychotics usage, when starting with children, comorbid medical situations should be well evaluated, and other medications used, and additional medical diseases and the benefits of the risk of the therapy should be discussed with the patient and the family, and it should be decided accordingly. Clinician should have a literature information about the medication, what tests should be carried out, hyperlipidemia, diabetes, cardiovascular diseases. Detailed family history should be obtained, and the history of the family is, the existence of it is not a prevention of using it, but it needs long-term monitorization. AKG, body mass index, weight, height, and blood glucose index, they should be taken into account during the therapy and in the follow-up period. and cardiology consultation should be obtained if needed, and BT and MRI is not needed if the history is not suspicious. American Diabetics Union and the lipid and the fasting glucose level should be taken into account. According to them, Canadian guideline says that they should be closely followed up, and the fastness insulin should also be taken into account when using of such medications. Antipsychotics usage among children. Low dosage should be initiated, and it should be increased gradually. If there is an adverse effect, these dosages should be decreased gradually, and once the effects are overcome, the dose could be increased gradually. Extrapyramidal findings should also be followed up. About cardiovascular, there is not enough study. For that reason, blood pressure and AKG should be followed up. If asymptomatic cases, lutein-prolactin follow-up is not recommended. Clozapine, AG and AG follow-up and pre and post treatment, blood counts should be carried out, and with their significant weight gain, liver should be followed up, and ketapine usage, eye medication, ophthalmological medication examination should be carried out. We should cut down on the dosages gradually. Experiential system side effects can be encountered if we abruptly cease it. When prescribing antipsychotics to children, monitorization follow-up is really important. Fasting glucose level and experimental findings should be followed up. Sedation and sexual side effects should also be taken into account, and further studies are needed in this respect. Thank you very much.